What is the difference between a hip flexor strain and a tear? Have you ever wondered what sets apart a hip flexor strain from a hip flexor tear? Both injuries affect the muscles that lift your thigh, but they differ in severity and damage. Let's break it down. A hip flexor strain is often the result of overstretching or minor tearing of muscle fibers or tendons. This can happen due to overuse, sudden movements, or not warming up properly before exercise. If you experience pain in the front of your hip, tenderness, stiffness, or mild swelling, you might be dealing with a strain. The damage can range from a slight stretch to a partial tear of the muscle fibers. On the other hand, a hip flexor tear is more serious. It involves a partial or complete rupture of muscle fibers. Tears are classified into 3 grades. Grade 1 is a mild strain with minor damage and little loss of function. Grade 2 is a moderate tear with more extensive damage and noticeable loss of strength. Grade 3 is the most severe, with a complete rupture leading to significant pain, swelling, bruising, and difficulty walking without a limp. Both injuries cause hip pain, especially when lifting the leg or during activities like running or kicking. However, tears typically come with sharper pain, muscle spasms, and a more pronounced loss of strength or mobility. For those pursuing a career in athletic training, understanding these differences is vital. Athletic trainers, physical therapists, and sports medicine professionals need to accurately diagnose these injuries. This often involves a physical examination and sometimes imaging tests, like magnetic resonance imaging, to determine the injury's grade and guide treatment. Treatment for strains usually includes rest, ice, compression, and elevation, often referred to as RICE. Physical therapy focusing on gradual strengthening and flexibility is also important. In cases of severe tears, especially grade 3, surgical intervention may be necessary, followed by rehabilitation. Preventing hip flexor injuries is a key responsibility for professionals in sports. Educating athletes on proper warm-up routines, stretching, and strengthening exercises is essential. Recognizing early symptoms can help manage them before they worsen, reducing the risk of a mild strain progressing to a serious tear. In summary, a hip flexor strain involves minor muscle damage, while a tear signifies a more severe injury, both requiring appropriate management in sports settings to ensure a safe return to activity and minimize long-term issues. Understanding these distinctions can greatly impact an athlete's performance and career longevity.